Hi, I'm Pamela Abner, and I'm the Vice President and Chief Diversity Operations Officer for Mount Sinai Health System in New York. And with me today,
I'm Francisca Ruth. Thank you, Pam. I am one of the administrative fellows for Mount Sinai Hospital, but I'm also an Aspen Institute fellow, so I'm very, very excited to be here this week.
good, thank you.
Thank you. Thank you, Pam. Hello, my name is Hazel Rogers. I am also an administrative fellow at Mount Sinai Health System, as well as an AIH health fellow as well. And I'm just really excited to be here. So thank you for having me, Pam.
Thank you. And I want to say congratulations to both of you on the fellowships that you have, right, here with Aspen and also with Mount Sinai Health System. So let's talk about your roles at Mount Sinai Health System as fellows. And let's just tell me about your experience. We know it's a 2-year fellowship that we offer for recent graduates, master's prepared students. And just tell me about your experience there. What has it been like and what have you done?
Absolutely. So it's been absolutely just everything I could have wanted and more. It was like you mentioned, a 2-year fellowship. My first year was 4 rotations where I was able to encounter different departments and different teams and really just embed myself within our healthcare system and really learn it from different angles. I was able to do an HR department rotation and anything from like support services to then ambulatory. So it really gave me a wide range of experience. And then in my second year, I was really able to pick one of those rotations and focus on that. So for me specifically, I loved ambulatory and the operations side of that. So that's where I spent my second year. So very excited about it. And it's been a wonderful experience.
Sure. In a minute, I'll ask you to go a little bit deeper on that. But Hazel, just tell me how you spent your 2 years.
Yeah, so my 2 years, it was very interesting. I think coming in the midst of COVID, it really challenged the fellows, I would say, in an aspect because we had to be agile. We were thrown in a lot of different rotations. So, for example, for me, I had the opportunity to work with leadership and patient experience. So I created the first workforce cultural transformation program at my hospital.
Great.
And with this program, we really focused on multiple subcommittees focusing on growth and development, as well as health equity, community engagement, and racial and social injustice. And also, I had the opportunity to focus on a new IT implementation, focusing on COVID-19 healthcare protocols as well. So it was really nice. I enjoyed my time.
So, we established the administrative fellowship program with an intention, right, to help us address and make a pathway for underrepresented folks to have a way to move forward in administrative leadership roles. So tell me, how did the fellowship prepare you for that, right? Because we wanted you to be able to come out of your 2-year program and then be able to assume a role within the organization where you had that kind of leadership responsibility and able to really jump in and go to work as a future leader for us. So can you talk about that?
Absolutely. So I think for my experience specifically, my first year was really laying down the foundation and understanding all the moving parts of such a large organization, such a large healthcare system. And then my second year was really focused on what does it mean to be a leader within my, department and within the healthcare system. But also coming from, our fellowship is really focused around the diversity and inclusion piece. So for me specifically, what changes and what am I bringing as a leader to make sure that our patient outcomes are improving and that my staff feels welcome and included with everything that I'm doing and the changes that I'm bringing. So I think the foundation that was brought by the fellowship was wonderful and able now for me to move into my new position of senior manager of our ambulatory, which I'm very, very excited about.
Congratulations. Yes.
Thank you.
Yes.
So I'm just looking forward to really expand on those experiences and move forward.
Great. And Hazel?
Also, just to piggyback off of Fran, the fellowship really prepared us because, as you mentioned, Fran, we have to focus on how to become an effective and transformational leader. Mm-hmm. So what does that look like? So for me, that looked like focusing on equity and empathy and really embodying teamwork and how that plays a role in patient experience, and also focusing on our staff engagement and our employee satisfaction as well. Okay. Because coming into my new role, I will become the Assistant Director of Patient Experience and Cultural Transformation. So for me, when I think about patient experience, I think about not only improving patient outcomes, but also making sure that our employees have more or have less psychological harm as well as less physical harm, to make them want to actually come in and feel productive and feel safe within their work environment.
Yeah, that's so important. So I just have to say that, we're so proud of both of you and the other fellows in the program. And this is something that's so important to all of us. And again, Dr. Davis, our CEO, has, sponsored and supported our having the fellowship program specifically as part of our initiatives under the umbrella of the Office for Diversity and Inclusion. So thank you for that. And then just very quickly, how does it feel to be here at Aspen as a fellow? Because it's something that you all just kind of got swept up into as well. So just what's it feel like being here this last few days?
Oh my gosh, the mountains. Can we talk about the views? The mountains is so stunning. Yeah. I just love, first of all, the speakers are just phenomenal. And then attending these sessions and coming out of them, seeing these breathtaking mountains is just so beautiful. But it's been an honor to be here. I think it goes to show that when you put, the speakers and all of these attendees together, and we're talking about different, the future of healthcare and what COVID looks like long term and the effect it has on our staff. We're having such engaging conversations, and I'm just so excited to bring this back to New York and keep this momentum really moving and going. I think that's the exciting part of attending a conference of this caliber, and just the ideas. It's definitely the Ideas Festival for sure. Yeah,
it's definitely a festival.
Yes.
I think more so than a conference, right? I think it's festive. And Hazel, your thoughts?
Yes. So again, as Fran mentioned, I'm really honored to be here. This is my first time on the West Coast. So yes,
great.
Yes, in Aspen, I think it spoiled me a lot. But yes, this festival has been amazing. We have a lot of great innovative speakers that really share the important ideas of how we can shape healthcare for the future. I actually attended this one session with regards to nursing and the burnout of supporting our nurses and also creating a more workforce model. And I think that's very important. And I think going into my new role, that's something that I can take back and share with the senior leadership at my hospital. So it's just been great.
Yeah, excellent. Okay, so you all get to flip it and ask me some questions, right? Yes.
I know.
So let's go for it.
So, Pam, I have a question for you.
Okay.
What does equity look like in the patient experience? What does that look like to you?
So from my perspective, and what we talk a lot about is fairness, right? So having everyone, all of our staff, whatever level that may be, who are interacting with our patients, understand that we want to provide service and care to our patients that's fair to them, that meets them where they are, and that's appropriate for them. Right, a lot of times in healthcare, people like to say we do things the same. Well, I treat everyone. I hear often when we're doing a lot of our programs, well, I treat everyone the same, and we have to understand that everyone is not the same, right? That people are different, their health needs are different, the way they respond to things are different, and really just understanding that as part of the patient perspective, that we want to kind of get that inside of our heads most, and then respond to folks in with that thinking. So I'm always, and then I kind of take it a little bit further when we start to address inequities, even though you didn't ask me this question. But when to get around inequities, it's like thinking about what's missing, who's not being served, and thinking about centering those individuals who've been marginalized in our society by a number of things, right? And systems, access, many social determinants that we know about. So having that focus and having that front of mind all the time, right? It's not just something like one day you think about equity. It has to be there all the time. And if we do that, I think that will definitely enhance our patient experience. And I know that you are so focused on patient experience, which is great. That is our core business and why we're here.
Yes,
so, yeah.
Absolutely. But that brings a great point. So do you think in order for us to tackle equity and make sure that it's at the forefront, is it a one-size-fit-all, or do you think we need to really be tackling this specialty by specialty? And what is your take on that?
So that's a good question, too. So I don't think anything about equity is one-size-fit-all except, right, when we think about leaders especially and others in our organization, making it paramount in terms of their thinking, right, making that top of mind. So that's like everybody should be doing that. But in terms of what we do actually, in terms of operationalizing, no, I think that we have to use data, which we are now doing a lot more of, and being very specific, looking at outcomes, if we want to think again about what happens with patients, and using those data to really drive interventions and things that we do to change, right? So that's very specific. And looking at patient populations, we're now in a fortunate position where we have granular information that we've collected on our patients. mainly, again, through efforts of our office over the several years to address deficiencies in how we captured patient demographics. And now that we've advanced that and we have that in a good place, we have information so that can help guide us, our researchers, all the work that can happen to be much more specific around patients. And so we can work very specifically, like with OBGYN. That was one of the first divisions that we started doing work with, and Dr. Stern, and focusing very specifically on particular disparities that were known to exist with women, and primarily women of color, but then we could really start to hone in on that. So that got to be very specific.
Absolutely.
Yeah, absolutely. Thank you so much. And you brought up a really good point in terms of data and how we use data to really drive different initiatives across the health system. Can you share a couple of health initiatives that Mount Sinai Health System has currently that really focuses on diversity, equity, and inclusion?
Again, around the data space, I'm going to go back to where we started with Dr. Stern, right? So that was when we started realizing that we had made significant progress in addressing the gaps in collecting patient demographics, where we no longer had that were kind of in the system and EPIC as unknowns, but we really started to populate that with background information on race, ethnicity, sexual orientation, gender identity, and language. Then we said, okay, let's start to work together with a clinical division. So we started there with Dr. Stern again, looking at some nationally known disparities that exist with women. And, then she's able to, in her division, do a lot of work, again, around addressing those. We've carried that kind of model forward, and we're now working through other quality leads in the organization to bring that same thinking in place, right? So for those, depending on what division it is, pulling the data on particular outcomes, working with our clinicians in particular to have them become more inquisitive about using information. So one of the things that we learned, and are continuing to learn, is that not everyone kind of wakes up in the morning and says, well, what's wrong? What do I need to do? Because people they don't look at inequities that way. Because people, especially in healthcare, you do things over time and it just becomes part of what you do. So this requires new thinking and new approaches. It's not just keep doing the same old thing. It's actually, we're saying, no, you kind of have to look at all your policies, look at all your practices, and kind of start anew with fresh eyes. So that's the work that we're doing now, and we're just starting to do that through our Quality Leadership Council with Dr. Lopatian and others, and really driving and honing in on that. And we've also brought in what I think is making it a huge success and difference for Mount Sinai Health System, is working with our school, because we have the good fortune of having we're an academic medical center. So we've also involved our researchers as well. So working with Dr. Horowitz and Dr. Richardson and Dr. Emma Ben and others, because the other important thing that we have to do is understand how to use data. It's not so much just to have it, but we know that there are some, people may misinterpret data, especially when you're looking at race, ethnicity data. So it's not just that it's there, but what does it mean? And we know that you just don't stop at looking at race data in particular and considering that as being causal, right? That people don't suffer inequities because they're Black. There's something else that's driving that,
exactly.
Right? So but that can get very misinterpreted and not understood clearly. So we're spending time also working with individuals to educate them in terms of what does this mean when you have the information, right? Absolutely. So that's very important in the process.
And I love that you bring up the point of, the one thing that's really important here, let's measure things. Let's measure and put them into words and actions. But also, how do you, as a leader, and your focus being on diversity and inclusion, how do you get the buy-in from everyone to make sure they take ownership of this? Because I feel like a lot of time this can get very, hot button political type of topic. Yeah. So how do you get, staff to really buy in and make sure that we are moving the needle forward and we are using this data to make the changes that we need? Yeah.
That's a great question. So there are a lot of things going on at Mount Sinai, right? That
everywhere,
everywhere.
The past 2 years.
I can say a lot of it emanated from the work that we do in the Office for Diversity, and our job is to help provide guidance and kind of raise awareness and make people aware about best practices and things. But the real work gets done, as you know. It's a collective effort. Leaders across the organization, our hospital presidents, our corporate leaders, our researchers and scientists. So it's not just us, obviously. So to do that, we do have a process and a structure, right? We have an executive diversity leadership board, right, that Doctors Charney and Davis are members of. And again, something that, through our office, but again, all the leaders are there and we talk about things, right? So we set forth, these are our commitments. These are our leadership commitments. And we have to draw any change that takes place in an organization such as this, right? has to happen from a leadership perspective. So, again, years in the making and talking and working through. We have our roadmap for action to address racism. That's huge, right? Very specific there. And we have very specific strategies and interventions that we want to see happen. And again, working through leaders across the board and holding others accountable. And that's really how we get the work done.
Absolutely.
Yes, thank you. So what do you think the struggle is with sometimes senior leaders communicating what we're learning at the top level to like frontline staff?
Yeah. We talk about that literally every week, right? So we have every week talk about it from the perspective of we have on, and it's something that's top of mind because we know that we're doing things. I can just say this from my perspective, just being real, that from a couple of years ago when we started this work, we were nowhere where we are today, right? Mm-hmm. I couldn't have the conversations I have now with with leaders, presidents, whoever they may be. 2 years ago, we weren't there, but totally different. And the way that we work together, it's completely different. And so sometimes you don't see it because one doesn't see it because it's incremental, and it just you see. But there's been change. But if you take a step back, even thinking about your roles as fellows, right, the work that's happened there to elevate you in the organization, we made some very specific changes there around how we wanted to elevate the presence of our fellows. We've done more in terms of weekly communications that go out, bulletins around actions that we're taking around our roadmap for action. But we also know that from a level, especially as you go down to frontline staff, that they might not feel the change as much as others. So we do want to continue to engage. So we're all, that's, again, that's always top of mind, and we're thinking about other ways to continue to engage staff so that they understand. But I can just tell you from a leadership perspective, I think it's a wonderful thing, and I'm just like so pleased that the leaders, we all come together so wonderfully, and everyone's really like, and I see it and I experience it and I live it. So from my perspective, like everybody's in, like their heads are in the right place. Is there more work to be done? 100% absolutely sure, because this is something that goes on for a while. This doesn't end at any particular time. This is our forever work, but we're all in it in a wonderful way. And I can see that even here at the festival, right? It's present here as well.
Absolutely, yeah. So we've been speaking a little bit about, what actions we're taking today and what it looks like today. What do you think, in 5 years or long term it looks like for Mount Sinai, especially with things that are going on today, but future plans for the health system?
See, I'm one of those who doesn't like those 10-year, 5-year questions. Didn't we talk about that the other day? We don't like those questions.
The future's unpredictable at this point.
So probably, in the perfect world, 10 years from now, we probably wouldn't need so much being driven by like our office for diversity, right? It would be that people are just kind of organically doing it themselves and advocating. But I do suspect that there will be other things happening in our environment where we still will need we will need that focus and that body as we do to provide curricula, education, and guidance on the path. But in terms of a culture change, I think that there will be a palpable culture change at Mount Sinai, which is what we're striving for. I think that this might not sound so nice. I think that individuals who don't buy in won't be there, right? Mm-hmm. So it's going to be, and I think we're doing this intentionally, but for good purpose, is that we want change. We don't want things to be the same. We want people to adapt new thinking, and we want people to understand equity and what it means. We want to, eradicate racism and bias. And if folks don't want to be on board with that, they won't fit into the organization. Mm-hmm. So that's what I think it'll be.
But I think that's very realistic in that point of change. I think many people are very hesitant to it. So I appreciate even as a fellow and learning from you that you are, as a leader, you're aware that not everyone will accept everything that you have planned out. Mm-hmm. So I think that's really important to be aware of the buy-in and the change of it.
Yeah. So I think that's what our world will look like in the future. So I think it's wonderful, and I think you'll be part of that 10 years from now. That's what I'm hoping. You two will be running the place.
Yes, absolutely. So then, Pam, just my last question for you.
Okay.
Just based on the diversity, equity, and issues that you have at Mount Sinai Hospital or Health System, how do you compare that with hospitals outside of the system?
A good question. So, we're a little braggadocious sometimes. I think that what we're doing is leaps and bounds beyond others. I do recognize, and I sit on a couple of national committees, and I interface with many across the country in this work. So I think many people are really doing a lot of good work. But I think that we got started from a different place, a different focus. I don't know of others who have taken on the addressing racism as we have. now everyone is just starting to talk about equity in patient data. We started cleaning up our data starting back in 2016, right? No, we really did, and it's huge, and you can't do that overnight. So
Absolutely.
we've moved. So we're further ahead on that alone than others because they can't do that work until they have the information where it needs to be. So I believe that we are much further ahead and we are leading in that perspective, and I want us to continue to be a leader.
I couldn't agree more.
Yeah.
Thank you. So I want to thank both of you for being here. It's been a pleasure hanging out with you these last few days and just
Likewise.
it's just been, and as we're both, we're all, the three of us together are just kind of wowed and amazed. Mm-hmm. But in terms of your contributions as fellows, I think it's tremendous, and we're so happy to have you here at Aspen as a fellow, and then, most importantly at Mount Sinai Health System as fellows too. So again, looking forward to you as future leaders and doing this work and taking us, where we need to go into the future. So thank you.
Absolutely. Thank you so much.
Thank you so much, Pam.